Hello, friends in Michigan and Indiana. Thanks for joining us this morning, and welcome to this special virtual town hall discussion by Bickford Senior Living. My name is Melissa Smith, and I will be your facilitator for this discussion and question and answer session today about all things coronavirus vaccine. So I want you to know, first of all, that we want you to ask your questions anytime throughout the presentation this morning. Right below this frame that you see me sitting in right here, right? If you scroll down, you'll see a form. You just type in your name, you type in your question, you hit submit, and that comes straight to us. And we will get your questions answered live today, this morning, during this session. So here's what we plan to accomplish today. We're going to answer your questions, any questions you may have about the vaccine and its distribution, not only at Bickford Senior Living, but also to seniors in general in the community. We're going to provide you with a timeline for vaccination distribution or vaccine distribution at the Bickford locations in your area. And for those of you who are hoping to move into Bickford in time to receive the vaccine, we will share the necessary steps to take to make that happen in time for the vaccine deadline. So I don't know about you, but I have found the arrival of the vaccine to be super comforting, very exciting. It's nice to see hope here in 2021 that we are going to get this thing taken care of. Just to reflect on some of the numbers over the past year, there have been more than 20 million Americans who have been infected with COVID-19. The death statistics for those over 65 are absolutely staggering. And we at Bickford really believe this vaccine is the game changer to knock out COVID-19. So I think that's all very important to remember. Bickford Senior Living was really proactive in the whole vaccine program. They entered into the federal COVID-19 vaccination program, and that's why Bickford now has access to the vaccine, which will be available on these dates that we're going to show you here in just a minute. We just feel really obligated to share this information with you because for those seniors who've thought about making a move to Bickford, maybe it's sort of been on the family agenda and part of the conversation, that we really wanted you to know that if you've held back due to COVID-19, now is a perfect time to move in, to get here in time for this vaccine deadline for sure. So let's show you the deadlines for the Bickford branches in your area. And when we say deadlines, it's really important to understand what that means. It doesn't mean that you're all moved in and all the pictures are on the shelves and everything is picture perfect. It basically means you have a signed commitment. You have taken possession of an apartment at Bickford. It doesn't mean that you have to be physically all moved in by that deadline, okay? And we're gonna explain and give more details about that in just a little bit. We're gonna go into giving you sort of an overview right now. So this slide here with the branches and the move-in deadlines, we're gonna come back to that a little bit later. So don't worry if you didn't get all of that information down. Okay, so for now, let's go ahead and get some of those basic questions answered. Some of those commonly asked questions about the vaccine. And to do that, we have two of Bickford's executives who are joining us. First, we have Ann Cheverton. Ann is the Senior Vice President of Resident Services. Hey, Ann, thanks for being with us this morning.
Nice to be here. Thank you.
Great. And then we also have Alan Fairbanks, and Alan is the Executive Vice President of Operations. Alan, thanks for being with us.
Oh, you bet. Absolutely. Thanks for having us. Appreciate the opportunity.
Of course. So I think the very first question we want to get to in terms of these basic questions kind of out of the way is, which vaccine is Bickford administering to their residents, to their Bickford family members, the caregivers and such? And then how many doses does this vaccine require? And I'll turn it over to you guys.
Yeah, thanks for that, Melissa. So initially, we have partnered with Walgreens to conduct clinics in all of our locations. And the initial vaccine is Pfizer. In the majority of our states and locations, that will be the vaccine. There may be, as most of us know, there's some Moderna's been approved, and there's an opportunity that it could be that that gets utilized later on. But what we do know is this: whatever vaccine is utilized, that will be the vaccine that is consistently utilized in that branch and in that clinic. And There will be 2 doses that are administered. They are generally going to be 28 days apart. So what we've been experiencing is when Walgreens has scheduled our initial clinic date, they've also scheduled a second date, in addition a third date, to be able to potentially pick up any individuals that have moved in after that initial clinic has taken place. So the trials have indicated that to be most effective, and we've seen 94% plus effective rates with the vaccine, you must take both vaccines, both doses, not just one dose. So it's 2 doses and typically 28 days apart. And the clinics are being conducted by Walgreens, usually Pfizer, could be Moderna, depending on each individual state and that local Walgreens location.
So to follow up with that, Alan, will the folks from Walgreens then come to the community to do that, or will the residents have to go to Walgreens?
No, they'll come to the community. Walgreens will come conduct clinics in our locations. They will come with their own personnel, and certainly Bickford will have personnel to support that as well, from an RN perspective, from a leadership director perspective. So there will be Bickford personnel there as well. So we'll have you covered from Walgreens personnel, and Bickford's personnel. Will be plenty of people there to hold your hand throughout the entire process.
Fantastic. So Ann, this is probably for you. So why would you say, as a health professional, why should seniors get the vaccine now as opposed to waiting until the spring, when I believe is when those who are 75 and older will have access to the vaccine? Why do this right now? And are seniors more at risk if they don't get the vaccine now?
Yeah, I think that's a great point. We know already, the data has shown us that our seniors today are more at risk than the general population, especially those over 75, which is the majority of our residents at Bickford Senior Living. And the death outcomes are very, very high with this particular group. So it is really a life-saving vaccination. It's going to prevent the infection and really prevent those bad outcomes that we see more with residents that have other comorbidities, other diseases that already weaken them coming into an infection. So the risk is much higher by age, by disease type as well. It's very, very important they get the vaccine, so then they're protected.
Mm-hmm. Very good. A lot of people I've heard, just in the general public, they talk about how quickly these vaccines were produced, and there is a little bit of worry around that. They were produced quickly, they were approved quickly. Do we need to worry about that?
That's another concern we've seen really in the internet as well. All of these different, questions about, is it safe? These vaccines have been produced very quickly because there was a great collaboration between multiple countries, governments releasing funds, the private sector, pharmaceuticals really jumping in. Some of these vaccines have already been in place with coronavirus. This is a different version of it. So they have these mRNA vaccines already kind of ready to go for regular coronavirus. So just trying to modify them to be ready for this, be mass produced, was done very quickly. No step in the process of the approval of FDA was missed. They go through very stringent guidelines and review. And we know today that at least 3,000 participants have to take the vaccine for it to approve from a phase 3 to a phase 4 clinical trial. We've had over 50,000 people have received the vaccine in that trial setting. And today, we also have seen over 4 million people have been vaccinated as well in our country. So we know that the vaccines are safe. We know the side effects are fairly minimal, and people are doing well with these vaccines.
You mentioned these side effects. Let's talk a little bit about what some of those side effects are.
Most of the side effects are very similar to taking any kind of flu shot that most of our residents take during the flu season. You might get a little bit of soreness at the site where you had the injection. We've done several clinics already, and we're seeing very, very minor pain at the site. But more typically, as your body starts to build up some immunity to the vaccine, you might have that initial reaction of maybe a headache, maybe a slight fever, maybe some body aches. These normally last for no more than a day or so, and you can recover from those very, very quickly. as long as people can take some Tylenol or Advil, or certainly take some fluids, make sure they have plenty of rest. We do know the second dose of the vaccine sometimes has more side effects. And so again, just making sure you're rested, to take fluids, take some Tylenol or Advil if needed. Most of these symptoms should be pretty mild and people can recover and even work with those symptoms.
So another thing that I'm sorry.
One thing I would add, Melissa, to the earlier question that you asked Ann in regards to the safety of the vaccine is, I think so many times people look at the speed at which this was done as a negative. One, I look at it as a positive because it's something that can happen quickly to be able to save the number of lives that this vaccine is going to save. And also, there's been so much publicity and so much known of this vaccine and this COVID. Can you imagine the stringency in which all eyes were watching? So my belief is that this is probably as safe and safer than any other vaccine that's ever been produced, because there's more people paying attention to this than anything that's ever been developed ever, in my opinion, just because of the number of individuals that are paying attention to this.
Such a good point.
I just add to that too, because really where the scientific community is looking at this is modernizing how we're managing vaccines today. This is innovative times for us. So this is not something that's done in a hurry. It's something that's really moved us as an industry in managing vaccines very differently than we have in the past. So this is actually innovative times that the pandemic has really pushed us into.
Another thing that has come up, or a question that's come up by folks, is can they get COVID-19 from taking the vaccine, or can they somehow give it to somebody else, give the virus to somebody else if they get the vaccine?
That's another really good question. Typical vaccines that have been produced in the past are often the actual virus itself. It's attenuated, it's not live necessarily, so it's vaccine you can take in smaller doses. This is different. These two particular vaccines that are out are called mRNA vaccines. These are genetic material. And what they do is they take a small amount of protein from the virus itself, and this obviously is injected, it goes into a cell, and that protein itself is what the body reacts to. So actually you're not getting any kind of virus at all, no live virus. You can't replicate virus from this. Also, that means if you don't have the virus, you can't give it to someone either. So it also means that you will not be able to give it to someone else. So people are safe in taking the vaccine, and other people with them are not at risk from getting coronavirus from the vaccine.
So what about a senior that perhaps has had COVID-19 already? Do they still need to get the vaccine?
As this is a new virus, even though coronaviruses have been around for a long time, this is a new version of it. And so I think because we know our seniors are most at risk, the advice from the CDC and from the federal government is for seniors, even if they've had it and or anyone had it in the past, to certainly have the vaccine. It gives you active immunity, it gives you that protection. We don't know how much protection you get from the actual having the infection itself. So this is an ounce of precaution, but certainly highly recommended that they do take the vaccine, even if they've had coronavirus.
I think so many of us are just, we're all growing weary, and our hope is that we're going to get this vaccine, and then we're going to be able to set the mask aside, and we're not going to have to worry about social distancing. Is that in fact what's going to happen? And if it is, when will that be, or do we know?
Well, I wish I could, answer that question, but the reality is we don't know. I do think this is certainly the step to move in that direction. Our stance will be that we will continue with the protocols that we currently have in place. We will continue to have caregivers in masks. We will continue to screen visitors, because the reality is we're not going to know who has taken the vaccine and who hasn't taken the vaccine from any individuals coming into our branches. So we will continue to follow the same infection control protocols that we had pre-COVID, and those more stringent post-COVID protocols we put in place as well. So I do believe, though, that soon we'll be able to move into worlds where our residents will be able to participate in communal dining. They'll be able to dine once again with their friends. You know, they'll be able to have activities within our locations in a group manner, in a group setting. So this will be a way for us to more quickly move into more of a normal world than certainly if we did not have the vaccine. So I do think we'll be able to move into that in a much more quicker fashion than we would if we didn't have the vaccine.
Awesome. We are going to get these dates back up here on the screen in just a moment for folks to know, for those who are considering a move into Bickford at this time, to be able to take advantage of this vaccine. Before we get to that, though, I want to kind of close this section out with you two. Is there anything else that you want to bring out about this vaccine coming into Bickford at this time that I haven't already asked you?
Yeah, for us and for Bickford, I think the thing that I would add is that we are going to continue to really strongly encourage and get as much participation in the vaccine as we possibly can, both from our residents, from our employees, our Bickford family members. I want that for everyone in the community, because I think this is our best chance to be able to move into a world where we can eradicate COVID from our world and from our communities. So we are going to continue to strongly encourage our residents and our BFMs to participate. What's happening is we're scheduling 3 clinics. The great news is if someone should happen to miss the first clinic, they're going to be able to participate in the second clinic and then the subsequent 3rd clinic as well. So our belief and hope is that we're going to get a large participation of residents and employees in our clinics and be able to get into a situation where we have a lot of immunity within our branches. And that's my hope and desire, that we'll see that out in the community at large as well.
Exciting news to hear. Anne, any final thoughts from you for this particular part of our Q&A? Yeah.
Yeah, I think that for me, it's about the numbers. We're over 20 million people infected with coronavirus, and we know the number is probably much higher. Testing wasn't in place early in the day. We know right now the pace of coronavirus is about 1.5 million people are getting coronavirus every week. We know our seniors are most vulnerable. And so for me, the game changer, the only thing that's going to affect this is clearly wearing masks and social distancing isn't doing it. Holidays have kept everyone together. So we know the only way for this to be eradicated is to take the vaccine. And so that's our strong stance. We are really strongly recommending people take the vaccine. It's a game changer for this pandemic.
Anne and Alan, thanks for that overview, and thanks for your patience at home. We kind of wanted to get that overview out of the way before we got into our attendees' questions this morning. And Joe, I'm going to get to yours first off here in just a minute. But once again, if you're at home and you have a question, all you do is fill out that form that's right below this screen where you see this slide that says ask a question, put in your name, put in your question, hit submit, and that comes straight to us. So Alan had to pop off. We've got Anne here to answer more questions, and Samantha Goodman. And Samantha is the Director of Sales for Bickford. Hey, Sam, how's it going today?
Great, thank you.
Good to see you, and thanks for being with us. So I want to go to Joe's question first. He says, my father currently is in the hospital with COVID. He gets out by next Friday. Should he receive the vaccine? Anne?
Yep, absolutely. Assuming that the hospital hasn't given him the vaccine. We have seen that in some situations where the hospital's actually done that. And obviously with our clinic and the dates here that you see up on the screen here, and I'm not sure, Joe, where your loved one is, but you can see the dates here. There's a good window here for him to get, or her to get, the access to the vaccine. And we have then 2 clinics. So this will be the second clinic listed here. And then we have a 3rd clinic where the second shot will be given as well. So the good news is, Joe, I think that timeline will work very much for your loved one to have the vaccine.
Awesome. Jenny has a question, And Jenny's question is, I think this is for you too, Anne. How do you determine if a loved one who is on seizure meds, though he hasn't had one for many years, and asthma meds, though not a bad case, whether or not they're able to get the vaccine?
That's a great question. And actually, there aren't restrictions in relation to the asthma or the seizure medications at all at this time point. Now, again, as this is a newer vaccine that is being evaluated, but right now there are no requirements to say take them off the medication or additional monitoring than we do already. The types of side effects that people are having are in relation to an allergic reaction to the vaccine or an immune response to the vaccine. So, but I would think that if you have any concerns there whatsoever, we can certainly check with a physician, the primary care provider, just to make sure that's the case. But we don't want people to stop their medications because obviously we don't want a seizure and we don't want to have respiratory outcomes as well.
Excellent. Sam, I want to get to you and kind of get us through the steps that it takes in order to be able to meet these deadlines that we're looking at here on our screen, because when we look at them, some of them feel kind of short. So maybe take us through, how do we actually make all of this happen within that time frame so that our loved one can in fact be included in the Bickford vaccine?
Right. Well, first and foremost, I think that it's going to be important to point out that somebody doesn't have to be physically moved into the branch. And so, as you mentioned, some of these timelines might seem a little tight if someone's concerned about having to sell their home and do all of the steps that you have to do to move in to get the vaccine. So it's important to know that someone would have to do is sign an apartment contract with us. And that's an apartment possession. And so that is signing that the apartment is yours, but you can have an actual physical move-in date after that contract is signed. And so we would help you then, navigate all the steps that you need to, sell your home and do all of those things and be a great resource for you along those lines. But at this time, we can help either come to you, virtually show you the branch. You can come to us and help with that, or we can do it over mail. We can come to your house. We can do it electronically, whatever is easiest for you to help expedite that process and get that apartment contract signed that says that the apartment is yours, and worry about those next steps afterwards to get you on the list to get that vaccine.
Well, that is super easy. So there's no obstacles other than somebody saying, yes, I want to do this, and can sign the documentation that says this apartment is mine. And then what about if it's not exactly the apartment they want?
Yeah, that's correct. I understand that, somebody might want if they're a gardener, they might want a courtyard view, or if they want to be next in super social and want to be next down to the activity room or something like that. And we don't want that to be an obstacle to trying to move in as quickly as possible. And so I would encourage you to get in as soon as possible so that that's not an obstacle to getting the vaccine, because this is a really important time. And so I would encourage you to move in, sign that apartment contract, or move in as soon as possible. And then as soon as that the appropriate or the apartment that you want becomes available, then we would of course take the steps to move you to the apartment that you would prefer. But that the more important part is to actually get in, get the vaccine, and then we can take the steps to get you to that more perfect apartment for you at that time.
And so move-ins are happening right now at Bickford. They've been happening through COVID, correct? And
Absolutely.
And so help us kind of get our head wrapped around how that works, because of course we still have COVID-19 happening.
Yeah, I think that's important to note. The needs of people have not changed, right? And I think Anne can talk a little bit to this, but the needs of our residents haven't changed during this time just because COVID-19 has been around. And so as things have gone on, whether it's medication, socialization is so important. We've seen that as we've noticed, the isolation of a lot of us at home. I think that that's really important. And so I think that we need to know that our move-ins have not changed at all, because, Anne can talk a lot about with our medications, with families going in and seeing them, particularly over the holidays. Somebody hasn't gone to see their parents for a long time, and then they see that, mom isn't doing as well as they had thought. The fridge might be empty, or they're not getting their medications, or we're having emergencies where somebody has fallen. And so we still have to do that. There's still needs out there, and it's really important that we are still addressing that. And so movements have not stopped this entire time. So, Anne, do you want to talk a little bit about that?
Yeah, absolutely. I think that, I think you mentioned it kind of very, very lightly, but, as you said, needs of residents of those in the community don't change. And so often what we'll see is families will wait because of coronavirus, or even just because of their sheer, they're unsure, what does this mean, having to broach the subject with mom or dad coming into a Bickford senior living or into a community like this. There's a lot of guilt and things that hold you back, and coronavirus really put the dampeners on that. But what we do know is that we'll see, people at home that are not taking their medications, maybe they're not bathing, maybe they're really not eating enough. You're seeing that deterioration. And we know that by moving them into Bickford Senior Living, we have a team of support and care around the new resident. We're going to be looking at their favorite foods and eating habits, making sure all medications are given. So any side effects or issues of them not taking the medication are all taken care of and mitigated nicely. And just bringing them into that kind of loving community environment with activities and social things, that we manage, and take care of. And so just moving from that loneliness and that isolation into an environment of care and services really can be a game changer and improving. And often we see in that first 30 days of that move in, they flourish, they do so well. So we don't want you to hold back based on coronavirus coming into Bickford, but obviously the vaccine is the game changer. So that's what we want you to take advantage of.
And Anne, I'm going to ask you about kind of what the latest stats are here in just a minute. But Samantha, Anne brings up a good point, and that is, family members may feel strongly about moving their parent at this time to get them into a safer environment where they're not isolated and they're getting meals they need. And Bickford and this vaccine could be the perfect answer for them. Mm-hmm. I want to put up your contact information because I think folks could reach out to you, and tell me if I'm wrong here, but I think I know you pretty well, is that folks could reach out to you who may have to have that difficult conversation. Mm-hmm. Do you help families have those difficult conversations?
Absolutely. That's what I want to do. We want to try and make this as easy as possible. My grandmother lived at Bickford. I understand. I've been on both sides of the table, not only with my own family and going through this. And, so I understand what it's like to have a loved one go through this and have that conversation, not only with my parents, helping them have that conversation with my grandmother, but please, I'd like to help you with that. This is a difficult time to do that. But one of the best things about moving into Bickford at this time is that, although it's been very isolating, in Michigan, and particularly with how locked down the state has been, if you go watch and you go to our websites right now, you can still see the love and, what's going on in the branches and the excitement. And so you might have the isolation outside and in the public, but there's so much happening in the branches and the love and the family that they're getting going on in the branches. And so they have that interaction and that, that excitement that's still happening individually at those branches. And so it's really phenomenal, so that they're getting that peer-to-peer interaction and that family there. So I think there's a lot, and so I think there's a lot that we can do. And so please reach out to me. I'd love to have that interaction and help you with that transition as well.
I knew that. I think that is, we often need coaching, right? As a family, we're not quite right with the words that we want to say and things. So thanks for that. That's terrific. So Anne, bring us up to date, if you will, on where kind of the statistics stand right now around COVID-19.
Yes, and I think it's a good to note. Obviously, we have distribution of vaccine, shots getting into the arms of quite a few people. Probably around 14 to 16 million people have had the coronavirus vaccine, which is great news. But it's not impacting our numbers yet, right? Again, we need to get more vaccine out there. And I know this is what the government, and now with Biden, we're working on very aggressively to get that into the arms of those that need it. But today, as I know, we have over 24 million people that we know have had coronavirus, and we know that number is very low because we didn't have enough testing in the early days. And some people are asymptomatic and they don't go to get tested. So we know that number is probably very low. Right now, the weekly rate is 1.3 million people tested and positive for coronavirus. So that number's been sitting there now for several weeks, 1.5, 1.3 million. But I think the saddest milestone, and this was recognized even yesterday, 400,000 deaths with coronavirus. So that's significant. And about 21,000 people die each week from coronavirus, just to put it down to kind of a more manageable number to get your mind around. But at the end of the day, highly contagious, highly infective. And the only thing that will make the change on this is to take the vaccine. Masking certainly helps, distancing, but the vaccine is the game changer and the only way we'll eradicate coronavirus.
And the vaccine is such a great reason to move into Bickford right now, but I want to say it is not the only reason. I've had the honor to work with you guys for about a year now and really get to know who you are, and it's across all of your branches across the country. There's a very special feeling about your communities. I believe you call it the heart of a caregiver, that you even have a mantra around that. And I just feel like it's important to remember that Bickford, yeah, vaccine's great, but there's so many other great reasons to move in there. Do you guys have anything you want to share around that?
Absolutely. So, I was just visiting last night with Andy, one of the owners. We're family run, we're still family owned. And I was visiting with him in regards to the heart of the caregiver and our why. And, one of the things that I think that we do better than anybody is I think that you can go anywhere and get your basic needs and your care needs met. I think that, that is very similar. In assisted living, you can do that. But one of the things that we do better than anybody is our unrecognized needs. And it's those things that somebody wouldn't think about. And it's those things that we do that really separate us. And it's why we're here. It's the reason that we get up and want to make our Bickford family members, our employees, want to make a difference in somebody else's life. And it's these unrecognized moments that bring joy. And it's our why, and it's very different, and it's a very different special meaning, which brings the family to each of our branches, and it's very special. And that is something that you won't find at someplace else, and it's what's really separates us, and it's phenomenal. So it was a good conversation. You have to.
And did you have? Oh, that's right. You do have to experience it. And that I'm gonna stop you right there because I have a short video, like a 2-minute video. I would love for folks to see. The vaccine has gotten into some of the Bickford communities currently, and this is a beautiful tribute to how lives will change once this vaccine gets there. So take a listen.
You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Move mountains, we gon' walk it out, and move mountains, and I rise up. I'll rise like the day. I rise up. I rise unafraid. I rise up, and I do it 1,000 times again. And I rise up. I like the waves. I rise up in spite of the
those signs are heartbreaking and they're inspiring all at the same time. Because yes, we all want to get this back to normal, don't we? Anne?
Absolutely, and I think just to kind of go a little bit back to kind of this unrecognized needs kind of idea, I think that, that makes us, different. Very much about enriching the happiness of individuals, and by doing that is really approaching each resident as their own individual. We do something called a life song, where we gather all the information about their life, their history, their family, their kids, their favorite things, the things they don't like. So we can be very mindful of that, and we build upon that during the time that they're with us in residency. And the idea is really to get to know what makes them tick, what makes them happy, especially if there's some memory issues and we need to maybe help manage some of those behaviors. We have a life song basket where we put some of their favorite things in there just to kind of jog them out of maybe if they're having some issues or sadness, especially in that first kind of 30 days of move-in. Such as if you know that someone likes hot dogs, that we serve, maybe instead of having the traditional lunch that day, we're going to give you hot dogs. Or if you have a need for ice cream, we didn't have any ice cream for lunch, but someone comes and gives you some ice cream. So just different things along those lines to make sure that we're always not just doing the task of care, the basic needs of care, but doing those special touches and those special moments as well. So, and I think what's awesome about this video, you get a little sense of the community there, but you get a sense of the energy and the excitement about things getting back to normal. I want to hug my wife. I want to be able to return to the life I had before. And again, this is what the vaccine will give us as well.
We're all ready for that, aren't we? For sure. And I think this next question is for you too. This is from Ruby, and Ruby, bear with me here. It says, I would like to know how the date for the clinic for each individual facility was determined by Bickford Corporate. Specifically, my mother is at Bickford, is it Okemos? Is that how you say it? Where the clinic is scheduled for February the 12th.
Yes.
In Ingham County, the vaccine has been available for her age group for 2 weeks now, per Ingham County Medical Officer. The information, I hope I'm reading this correct. The information I have from someone at the office is that each assisted living facility in the area was responsible for scheduling their clinic time with Walgreens. So it sounds like it's around when Bickford scheduled with Walgreens.
Yeah, great question. And I'd love to say if I had complete control of that, we'd have had it in December. So the way it worked, as you understood a little bit earlier from our earlier discussion with Al and I, and through what Melissa said, is that we started very early on in actually September trying to get on a list for vaccine. We reached out to all health departments across all of our locations and got very mixed responses. Then we found out in October that we had access to get vaccine through a federal program. This is the program that with Walgreens and CVS. I signed us up immediately for that program. We found out just before Thanksgiving we were in the program. And at that time, we also found out very early into December that they were going to move assisted living from the 1B category, so the second level down of getting vaccine, to the 1A category, which is great. But we still were third tier to hospitals first, then long-term care nursing home, and then assisted living was kind of third on the list. And Michigan specifically, and also in Indiana, we had evidence that the states were really scrambling on trying to manage, because the states still had to manage the vaccine with Walgreens and distribution. And so we started reaching out to Walgreens. There was a contact number to say, hey, we're on the list, we haven't heard from you, because in other states we'd heard from our vaccine partners with Walgreens. And so we kept on reaching out. And so it took a while for Michigan to schedule with us. I don't know any reason behind that. There's no data I can look at. There's no more challenge I can do, but we have actually done that and actually started to say, can you move us up a bit quicker? I think where the confusion comes here is that because there was this slow distribution of vaccine, now we were told about 100 million doses, right? And I think to this point, my stats today show 36 million doses are out of the 100 million doses, this kind of slowness. And there's a lot of criticism. We saw then within that time period as well that they changed the age date, which is great, from 75 to 65, because that's truly the at-risk category, which I am just so pleased with. We have some residents in that age group as well, which is very important. And essentially, I think because of this distribution issue, I think they just decided, I actually heard this about 2 weeks ago, 3 weeks ago, they decided to open up vaccine distribution to other ways to get vaccines into the community. So there's 15 big box pharmacy stores, so like your Targets and your Walmarts and these other, Meijer, for example, are now getting access to vaccine and making appointments for vaccine. So unfortunately, it just means that our dates were set where they were set, even though we have asked to see if there's a move up. We've had a couple that have been able to move up actually in Michigan, which we're delighted about, but we don't get to control that. We get to talk about it, align it, make it happen, but we are not in a decision-making, process here. So unfortunately, I think because of that distribution issue and because of vaccine now wanting to get it out to as many people as possible, 65 years and older, that's what you're seeing. And that's just I think that's just as things rolled and things changed, the government responded and they decided to open it up, which is the right decision to do. The more people vaccinated is our opportunity to get the pandemic under control and hopefully gone forever. But yes, it meant that there was a bit of a, this kind of uncomfortable situation. How come we don't have it yet, and yet someone in the community can? So my viewpoint on that, quite honestly, Melissa, is that, get vaccine out to everyone. We'll keep our residents, safe, protected, and the vaccine will be, at this point, put the date in place.
Got it. Thank you for explaining that, Anne, for sure. And before I reach back to both of you for your kind of final thoughts for today, I'm going to go ahead and put Samantha's information back up on the screen for those who may not have had a chance to jot that down. And if you don't have a pen and paper, it's okay, because on this web page that you're watching this right now, that form will stay there, and the link that you received in the email, that will continue to bring you back there. We're recording this even as we speak, and as soon as we are done and sign off, it will automatically start playing that recording for you. So if you want to share it with a family member, if you want to share it with somebody else, and again, use that form if you don't have the time or the utensils to write down this information that we have here on your screen, because I know Samantha would love to connect with all of you. So any parting thoughts from the two of you before we let folks get on with their day?
I just hope that, I'm hoping that you guys use this opportunity. We'd love to help with anything that we can. I understand that it's been a scary time, and we're hoping that this provides an opportunity. We feel that with everything that's going on, that the vaccine is an opportunity to help, and we feel a great advocacy towards it. So we're hoping that the town hall helped provide some information and clarification for you.
Anne?
I think I probably already said it, but I can't help myself from repeating it. But we know that the vaccine is the game changer. Access to vaccine is the game changer. But I think it's two things. It's also looking at what we can do to help, service, your loved one, if you're considering yourself moving into Bickford Senior Living, and to welcome you into the Bickford Senior Living family, where we're going to take care of you and try and continue to work on those unrecognized needs and make you feel very, very happy in a place that's safe and secure. So we'd love to have you with us, and you have this great opportunity to have vaccine as well.
Hopefully we've helped them visualize what it would feel like to make a move to Bickford, and to do it in a tight time frame, which sounds like you guys have figured it all out. It's very, very doable, and to be able to move into this wonderful place to get the vaccine, but also to live out a beautiful life, because it is a very special place with special caregivers for sure. So we thank you all. We hope that you stay well, and we hope to see you at Bickford. Have a great day.
Goodbye.